Are you able to confirm who is already online? Because there are two groups. We have the ministerial attendance and also our country leaders. Elena, IT.
Sorry, Dick. I see there's 144 now.
Yeah.
Fine.
Yeah. I see here there are the ministries, there are WRs, and also our officers. Okay. Okay. Okay, if it's okay, we could start. Honorable ministers, regional directors from WHO, Afro, and EMRO, a Director General, Africa CDC, esteemed colleagues, ladies and gentlemen, good afternoon. It is my honor to welcome all of you in this important webinar on the pandemic fund. I am Dr. Dick Chamla. I am the Program Area Manager for Emergency Preparedness, the WHO Afro here in Brazzaville, and I will be your moderator today. A bit of housekeeping before we begin. Please note that translation is available in English, French, and Arabic. And all honorable ministers will have an opportunity to ask questions after the end of the presentation and remarks of our leaders. If you have the question, please raise your hand or write your question in the chat or Q&A button. Honorable ministers, in December last year, Pandemic Fund Board approved a grant envelope of around $500 million for its second round of funding to primarily strengthen emergency preparedness in countries around the world, with a crucial focus on low and middle income countries. However, despite having the highest burden of public health events and other emergencies in the world, only a handful of African countries received funding in the previous round. Recognizing this disparity, Africa CDC and the WHO, Afro, and EMRO have joined hands and forces to champion a harmonized and collaborative efforts in this second round of pandemic fund to support our member states and optimize opportunities to avail more resources in our continent. As previously stated, we have allocated 1 hour in the webinar, and I would now like to invite His Excellency Dr. Kakasea, the Director General, Africa CDC, to start having his keynote address. Bienvenue, sir.
Good morning for some of you. Good afternoon for, I think, the most of us. And I'm so sorry because I'm not formally dressed. I just landed to Geneva. I have a meeting with Dr. Tedros and his team in the next 2 hours, and then with African Union ambassadors to Geneva, because we need to see how to push the pandemic treaty. As all of you know, we are not making progress, and we need to see how we can finalize in the next 3-4 months. With these apologies, please let me more formally make my remarks. Honorable ministers, my sister, Dr. Mweti, the regional director, WHO Afro, Dr. Anan Balki, regional director, WHO EMRO, for all colleagues, as she told us, she started today, and this is our first meeting as regional director, WHO EMRO. We are so honored to have you, Dr. Anan. I want to thank all of you for connecting with us today. as we meet to discuss the opportunity of the Pandemic Fund for Africa and how to co-create a coordinated Africa approach to the Pandemic Fund. I think Dr. Shamla already provided a kind of background on and the context why we think to have this approach. We know that we are also led by the Joint Emergency Action Plan that is putting us together, WHO, Afro, EMRO, and Africa CDC, to see how we can support our countries to better respond, to be prepared and to better respond to any kind of public health emergency. As you know, this Joint Emergency Action Plan, this is an 800 million document, and we are looking for all ways to fundraise and to start to deliver this program that we developed all of us together. We are led by the spirit of accountability and efficiency. The Pandemic Fund issued a second call for proposal amounted $500 million, as we know. We are also led by the 18% that Africa got from the first round, and we said it cannot be the case now for the second round. This is why we decided together to have this common African approach that will help us to leverage sufficient resources for our countries, while we are congratulating the 5 first countries that were Burkina, Cabo Verde, Ethiopia, Togo, and Zambia. We have also to learn that Africa was the only continent without a regional or multi-country proposal. While we have this opportunity to respond, as we know that there is this cholera outbreak in Southern Africa, we cannot have a country approach to respond to cholera. We need a regional approach. And in Africa, when we talk about a region, we are not talking about the continent. Africa has 5 regions. For the second round, Africa CDC and WHO want to invite member states to join the Common Africa approach, which includes this regional proposal, multi-country proposal, in addition to each country specific proposal. We are clear on that. Countries will apply, but we want to see how, in addition to country proposal, we cannot have a regional proposal or a multi-country proposal. We will then support our countries and our regions to develop these proposals, quality proposals, and we are keen also to invite other partners to join us, because we are talking mostly about the One Health approach. And it means we are talking about other partners that are playing a key role to support this One Health approach. We are also thinking about how to bring together what we call the RECs, regional economic communities like SADC, ECOWAS, EAC, and others, to see how we can have a strong proposal that will be led by this regional approach to better support our countries. We, as you know, there were so many requests to Africa CDC because everyone was thinking that Africa was not well treated for the first round. And this request came from not only African countries, but also key donors to see Africa CDC becoming implementing entity. Excellencies and colleagues, let me inform you that we successfully applied to this window to become implementing entity. We got the first feedback, and now we are working with the Pandemic Fund Secretariat towards achieving this process. We'll keep you updated when it will be finalized. I wanted again to thank the technical team that worked so hard to put together everything from the 3 organizations. And today, it's an opportunity for us to hear from you, ministers. And we love to hear from your feedback and how you think we can better support you to be successful for the second round. Back to you, Dr. Shamla.
I really appreciate on your remarks, His Excellency Dr. Kaseya. And without further ado, I will now please to invite Dr. Mashidiso Moeti, a Regional Director for the WHO Regional Office for Africa, to make her address. Please, over to you.
Okay, thank you very much, Dr. Chamla, our moderator. Honorable Ministers, good afternoon, good morning, bonjour, bon dia. Dr. Jean Kaseya, my colleague and brother, the Director General of Africa CDC. So it looks as if you and I were both traveling overnight. I just landed in Brazzaville a short while ago, at least this morning, and I was very pleased to be here on time to join our meeting. And I'd like to welcome and very warmly my sister and our colleague, Dr. Hanan Baki, the Regional Director in EMRO. We're so pleased you could join this meeting. Thank you for making the time on your very first day. And dear colleagues in all our countries on the continent and our technical team, good afternoon from Brazzaville to everyone. And thank you, Honorable Ministers, or your representatives for taking the time to join this webinar. It's already been said by my two colleagues, our aim is to help you, our member states on the continent, to optimize the funding from the pandemic fund, and certainly to do better than we did in the last round. The pandemic fund now accepts regional, multi-country, and single-country applications. And we hope to optimize these combinations so that we have the resources to improve capacities at the national, cross-border, and regional levels in the most important intervention areas. That is our aim. We know, and I think a colleague is going to present shortly, that the focus areas remain the same. So it's very much about building the preparedness and response capacity to pandemics and disease outbreaks in the region. I noticed that they put some emphasis on multi-sectoral action, and again, and agree with Dr. Kaseya that we need to look at our colleagues, including FAO, and at your level, ministries that are responsible for animal health, working within the One Health framework. And they emphasize a lot, I just would like to say, the importance of getting down to the community level, involving communities, involving civil society. I'm certain that you'll have the opportunity to look at their guidelines and as you start the preparation of your proposals at different levels, and we just have to help to make sure that we optimize and respond to the areas that they've emphasized in these guidelines. My brother, Dr. Kaseya, rightly mentioned that we as WHO, both Africa and EMRO regions and Africa CDC, are therefore spearheading this joint effort to support our member states in the second call through the Joint Emergency Action Plan, or JEAP, that we launched during the World Health Assembly, which defines our collective work on emergency preparedness and response. We found out, and we were very pleased to see that it aligns very well with the vision of the pandemic fund, with the priorities that they've articulated, and also corresponds to the vision of many of our countries, because we are working with you, supporting you to develop your capacities in these areas. We are certain that together we can strategically help to secure a larger share of the funds, a larger proportion of the 500 million, and make our continent stronger and more resilient to current and future crises. We have 4 countries, it was said, that succeeded the last time. Some of the criteria in cutting the number of countries we become aware of afterwards. But it would be good at some point if we shared the characteristics of those of those proposals that did succeed. I happened to have been in Addis yesterday and was part of the celebration of the Africa CDC anniversary, and had a conversation and heard how the Ethiopian government structured and worked very much around multi-sector, working on animal health system strengthening. So these could be examples that we learn. I'm not certain if Minister Sabine of Rwanda, who knows in depth what is happening within the board of the pandemic fund, is connected to us, but we could also benefit from his advice, I believe. We do understand that we have 55 countries, and that means 55 unique needs. And we think, though, that we are well positioned to jointly provide tailored support, ensuring that no country that wants to make a pitch for the money in this fund is left behind in terms of support. So we think that more than ever, a consolidated regional pandemic investment plan is necessary. As my colleague said, we have regions, we have 5 regions at least, if not more, on our continent, and we need to see how to work between having regional proposals, regional meaning more continental proposals, multi-country proposals that combine the needs of groups of countries. And of course, we understand that member states may want to, again, try for single country proposals. I also, before I conclude, like to say that we are aware that there are going to be other opportunities for financing for building our pandemic and epidemic preparedness from the African Development Bank and from the World Bank. And just say that we will be working to see how to get the information circulated to you, working with those partners, and support your efforts to make a pitch for that money as well. I'd like to conclude in my turn by thanking our teams that have been working so hard together in WHO, Afro and EMRO, and in the Africa CDC, and say that, in fact, our work will just be beginning as we now get down with our country teams, with the regional centers of the Africa CDC in supporting the work ongoing to develop the proposals. So thank you so much for having joined us today, and I look forward to a fruitful discussion. Thank you.
Thank you so much, Dr. Moeti, for actually your remarks. And there had been a lot of alignments between the statement coming from His Excellency Director General and our Regional Director for Africa, emphasizing on the issue of the multi-sector approach, and also they've been mentioned on the Joint Emergency Action Plan, in which WHO, Afro, EMRO, and Africa, the CDC, are collaborating at the moment. I will now turn over to our
Dr. Dick, we don't hear you well.
Okay. Okay, Lord, do you hear me now?
Yeah,
Hello?
a lot better.
Okay. I will now turn over to our new director in the region. Okay, Dr. Hanan Hassan Balki, actually, to have his remarks. Over to you, Doctor.
Thank you very much, much appreciated. Honorable Ministers of Health, distinguished colleagues, Dr. Kasaya, my brother, and my sister, Dr. Moeti, thank you both for the warm welcoming on my first day as Regional Director for EMRO. 2023 was a highly significant year for the 22 countries of the WHO Eastern Mediterranean region, 7 are which are on the continent of Africa. The acute conflicts in the Eastern Mediterranean region have costed thousands of lives and continue to undermine extremely fragile health systems. Across our region, we are repeatedly seeing the convergence of conflict, displacement, climate stress, natural disasters, and heightened risks of infectious diseases. The consequences of health security are enormous, as you all very well know. In 2023, the WHO responded to 73 disease outbreaks across the region, double that of 2022. And while we appear to be constantly in response mode, we never overlook the critical importance of prevention and preparedness. Why it's extremely important, as mentioned by the 2 esteemed speakers before me, with WHO and Africa CDC through the JEEP is so important. It will play a critical role in supporting countries in our region to strengthen emergency preparedness and response systems, including for present realities and for emerging health threats. So the JEEP is well positioned to offer countries unique support in this second cycle of the pandemic fund. All three partners will pool technical and other resources to ensure that our member states benefit from increased resource mobilization. In EMRO, we are encouraging our member states to prioritize sustaining the many gains that we have achieved together with their leadership during the COVID pandemic. We conducted a study last year that documented tremendous gains in surveillance, laboratory capacities, clinical care, oxygen generation, RCCE and IPC, but the COVID money has diminished, and we cannot afford to let these gains fade away. JEEP will leverage, so with a firm commitment to leveraging no country behind, the JEEP will leverage the power of collective bargaining to maximize the chances of our member states in securing a more significant share of the pandemic fund allocation, as well as mobilize funds from other sources. So I'm very much looking forward. This is my first day on the job, that we can work together with One Health Security for Africa, and we can extend those lessons and benefits to all countries of the East region. It will be a difficult challenge, but we are really working together to make this a reality. Thank you, everybody, and over to you.
Yes, so much appreciating you, Dr. Balki, and you have raised another issue of the overlap between the conflicts, public health events, and climate-related disaster, in which also it's a new emerging issue in which we see it in a number of our countries in Africa. So after hearing the remarks from our leaders of the Joint Emergency Action Plan, we are now ready to move into a next part of our webinar. And here now, I would like to invite our steering committee members of the JEEP to make a brief presentation on the pandemic fund. Ladies and gentlemen, I would like to welcome Dr. Abdul Salam Geye, a Regional Emergency Director at WHO Afro, and Dr. Ahmed Owel Omar, a Deputy Director General of the Africa CDC, and Dr. Rick Brennan, a Regional Emergency Director at the WHO EMRO. Please, over to you, Dr. Salam.
Do I understand that for me to present?
Exactly.
Thank you very much, Dr. Dick, and thank you very much, honorable ministers and our principal, for attending this seminar that I believe is the beginning for collaboration for pandemic preparedness financing in Africa. Next, please. Just to say that this is a continuation of work that is being done for the last years. We work with almost all the countries in Africa to assess the preparedness level by doing joint external evaluation or STAR or other type of assessment. After we work with most of you to develop a national action plan for health security, the problem was that most of the national action plan for health security was not funded. And we admit also the accompaniment we did in doing the evaluation, the assessment, and also doing the planning. We did not do it enough in supporting you in the resource mobilization. And that's why we get together, among others, to work with Africa CDC, EMRO, to develop the JEEP. The JEEP is a Joint Emergency Action Plan, and it is a continental one where we identify some priority action that need to be done. We develop it together, and we are working together to look for the financing. And those financing is not only for the pandemic fund, but it is on all possible funding, including internal funding at the country level, but also funding from development bank or funding from other donors that are mostly grant. Next, please. This is a summary. I'm sorry, the slide is very dense with a lot of information, but I will focus on the 5 pillars that initially we developed and that went to 8 pillars to work with countries, to work with all experts in order to identify what are the priorities and what are the action and the costs that are needed for Africa to be better prepared for pandemic. There is first pillar on country preparedness assessment that I just said about joint external evaluation, STAR, and USPR, all those type of assessment that are necessary for countries to know their level of preparedness to implement the international health regulation. There is also the workforce pillar that each of them have a working group, and the workforce pillar also is to have an emergency health workforce that is qualified, interoperable, and interconnected in Africa, that are ready first to respond to emergency in the country where they are from, but they are ready also to be deployed in other countries with the support of Africa CDC, WHO, through the search among. There is the surveillance pillar, laboratory and genomic sequencing, the logistic and supply chain, that was one of our weakness during the emergency response, and finally the response and readiness pillar. Those were the initial 5 pillars, but this is a dynamic document. We work together and identify that there are 3 additional pillars that needed to be developed. One is about RCC, is the risk communication and community engagement. One is about climate change, and the 8th one is about digitalization in the health system. So each of those pillars have a working group that we continue working for the last year and a half. So it is way before the pandemic fund. And we will also use it anytime that there is a funding that aligns with African needs. It is not that the funding that's going to determine where we go, but we have already determined the African needs, and each funding that arrives, we will check if it is aligning. The pandemic fund does align with what we described. As you can see, the workforce development is the same that pandemic fund has identified as a priority. And the third is surveillance, laboratory, and genomic sequencing, which is the 2 other pillars that the pandemic fund has identified as priority. So the priority of the GIP perfectly aligned with the priority of the pandemic fund that my colleague will present to you soon. Next, please. I will pass the floor to my colleague from EMRO, Dick, who will present to you quickly what are the elements of the pandemic fund.
Great, thanks very much, Salam, and honourable ministers, excellencies, colleagues, very good to be with you. So for this second round of the pandemic fund, there'll be $500 million available globally for countries. And as Dr. Kasaya and Dr. Mwedi mentioned before, there are 3 different types of proposals. There are single country proposals, multi-country proposals, and regional proposals. Dr. Ahmed will explain the difference amongst those proposals in a few minutes. But essentially, all countries on the continent are eligible to submit single country proposals in the second round, except those 5 countries that were successful in the first round. So 50 of the 55 countries will be eligible. Nonetheless, that's for the single country proposals. Nonetheless, all countries, including those 5 successful in the first round, will be eligible for both multi-country and regional proposals in the second round. Some of the challenges of the first round, there were 17 proposals that were funded, including 5 from the continent of Africa. Now at one level, that sounds not too bad, but when you look more deeply, what that means is we only covered 5% of the population of Africa in that first round. This is really considered, I think, a missed opportunity for the continent. There were no multi-country or regional proposals presented from any of the countries on the continent in round one. And in fact, in that round, 18% of all funding went to 3 multi-country proposals that were successful. So there was 1 multi-country proposal from the Caribbean, including 12 countries, another successful submission from 7 countries in South America, and another successful submission from 5 countries in Central Asia. So those 3 multi-country proposals covered 24 countries and generated 18% of the overall funding. So in this second round, we do think that we need a more diverse approach to the types of proposals that we submit to increase the likelihood of successful proposals. Certainly, we don't want to discourage the single country proposals, but we do also want to encourage the multi-country and the regional proposals. And certainly, through leveraging this tremendous partnership that we've formed now between Africa CDC and WHO Afro and WHO EMRO on the continent, we're willing to really leverage all our capacities to submit, to support you in the development of those proposals. So a couple of key dates to keep in mind. The deadline for the submissions for the second round is the 17th of May, and the announcement of the successful submissions is expected in October. Next slide, please. So Dr. Salam touched on this a little bit earlier, saying that there's great alignment between our priorities in the JEEP partnership, as well as the priorities for the pandemic fund proposals. So there are 3 priority areas for the pandemic fund: surveillance, laboratory systems, and workforce strengthening. And as you can see in this slide, these are some examples of the types of activities or investments that you may want to consider in your proposals. So in terms of surveillance, it's building better systems, including digital tools to assist with data generation and analysis, ensuring connectivity within countries and among and between countries, strengthening multi-sectoral genomic sequencing, and certainly making sure that there are connectivities between public health, animal health, and environmental health in terms of data sharing, common analysis, and so on. Secondly, around laboratory systems, strengthening those processes for sample collection, transportation, and referral, advancing national biosafety and biosecurity processes, strengthening the quality of the lab work and monitoring that on a regular basis, and so on. I won't go through the full list. You can see the activities there yourself. And of course, then workforce strengthening, absolutely vital, big lesson from the pandemic, and that collectively we need to invest in well-educated, trained, and appropriately compensated workforce. And we're also looking at options for building regional centers of expertise and excellence that can serve as hubs to train the health workforce of the future. So let me leave it at that. But one point that I think I'd like to add was just to build on what Dr. Hanan said. I think across the continent, across the rest of the EMRO region, we already have invested a lot in these different types of systems. With the COVID money, we've got to sustain those gains before those gains disappear. But thank you. Let me hand over to Dr. Ahmed for the next phase.
No, thanks a lot, Rick, and thanks, Salam. Good afternoon, Your Excellencies, Honorable Ministers, the 2 regional directors and the Director General of Africa CDC colleagues. Now we shift a little now that we've seen the types of proposal. Let's shift a bit into what each and every one means. And let me start by saying that as has been agreed, and our principals speaking at the beginning emphasized that we now want a common Africa approach to round 2 to increase the chances of us getting the resources that we need on the continent. So of these 3 types of proposals, The single country proposal, the process remains essentially the same as it was in round one, where one single country picking from any or a combination of the three priority areas will submit a proposal along with an implementing entity, and all the activities are going to be within that country. The ceiling has been set at $25 million per application per country. And although the process remains the same as it was in round one, where we and Africa CDC and WHO will provide support, what is different this time is that we are going to intensify that support. We want to work with countries very closely to ensure that what you're presenting as a country proposal is not just of good quality, but also has a good contribution from ourselves as Africa CDC and the WHO. Secondly is the multi-country proposal. This is a proposal that is submitted by 2 or more of the eligible countries. And of course, for each proposal, you'll need to have an approved implementing entity, which then, I mean, those countries that are participating in these multi-country proposals, that is where the resources are going to be applied. So the benefit is to those countries that are applying together. For multi-country proposals, the ceiling has been put at 40 million for each and every proposal. And we as Africa CDC and the WHO are going to provide support to each and every multi-country proposal. And we are going to intensify that to increase the chances of the proposal getting selected. We indeed are proposing that as we work on identifying which multi-country proposals may be useful, we really are encouraging our member states to be flexible in the sense that we pick the best possible application to put forward. The third type of proposal is the regional entity proposal. This is essentially a proposal that has been submitted by a regional entity, whether it is a regional economic community, whether it is a continental institution like the AU IBAR, or indeed as Africa CDC, depending on whether our application for implementing entity will have passed through or not. Whichever of these established regional institutions are going to make the application together with an implementing entity, then those benefits will go to the countries that have been identified as aligning to that particular region. So for example, if we went with a regional proposal in the Southern Africa region where SADC is an established regional economic community, then those countries within SADC are the ones that are going to benefit. It will be the same for ECOWAS, for ECAS, and for the East African community, and even the Arab Maghreb Union in the northern part of Africa. Indeed, our specialized institutions within the Africa Union, like AU IBA or PANVAC, which is the Pan-African Veterinary Vaccine Center, these are also eligible regional institutions that can be able to put in an application together with an implementing an approved implementing entity. Again, the ceiling for the regional entity is $40 million per proposal, and we have committed to work very closely with these regional proposals so that we can get good quality that is going to result in as much resources coming to the continent as possible. Of course, in all three modalities, implementing entities that have been approved, including WHO, the FAO, and if our application goes through, including Africa CDC, all these three modalities are going to require that we coordinate the types of proposals that are going to go through to the Pandemic Fund Secretariat, so that we are covering as much of our need on the continent as is possible. And that is why, partly why we have this discussion today. Next slide, please. So now, Your Excellencies, Honorable Ministers, Regional Directors, DG, Africa CDC, I would like to hand this back to the moderator so that we can really look very clearly at these objectives, looking at how do we cultivate an understanding of the common African approach to the pandemic fund applications. How do we seek effective feedback on the best design when we are implementing the common African approach? How do we build stronger regional and multi-country proposals? And we really would like to have a highlight on the specific areas of support that may be required from ourselves as Africa CDC and from WHO as well before that application deadline of May 17th. The time is short, but working together, we are confident that we can be able to put in good proposals that are going to produce good results for the continent. Back to you, moderator.
Really appreciate our steering committee member for a brief and clear presentation on the structure of the GIP, on the introduction of the pandemic fund itself, types of proposal and priority areas, and what kind of technical support a WHO, Afro, EMRO, and Africa CDC to be able to support our member state. So we have reached now our time for opening up a floor for your initial responses. And building from the last slide of Dr. Ogwell on objectives, I think now it's time to ask your questions. And the floor is open, and please, the support team help us to actually identify hands which have been raised, and also if there is any question in the chat. So I will start with one hand here from Desire Hadama. Please go ahead, Hadama. And please tell us where I think you come from and what is your title, and ask your question. Over to you, Desire Adama. IT, are you able to unmute?
It's a mistake, please, sir. Good morning. It's a mistake.
It's a mistake. Okay, so we have another hand here from Dr. Ning. Is also qualification. Oh. Please lead Dr. Ning, DGSP, please go ahead. Oh, we don't hear you, Dr. Ning. Okay, I hope our IT colleagues will start to address IT issues in which, are now emerging. We have a number of the question in the Q&A box, so I will actually initiate one reading of this email. So here is the question from One Health Technical Working Group, South Sudan. And the question is, please clarify the disadvantages of a single country proposal as compared to multi-country proposal. Please, Omar, do you want to answer this? Over to you.
Yeah, sure. And thanks to our colleagues in South Sudan for seeking clarifications of that. I will not call them disadvantages. Each country, being a sovereign entity, can be able to decide to put in a single country proposal. Indeed, the decision about a multi-country or regional proposal will rely on how much prepared a country is to implement any of those proposals. When it is a regional proposal, for example, then you have the backing of other institutions that may have very advanced technical capacity to help you with that implementation. So it becomes an easier path, if you want, when you go down the regional path. A multi-country proposal, depending on the uniqueness of the different countries, because these can come from different regions, depending on the uniqueness of the countries coming together, then one could follow the multi-country route. But the individual country proposal would look at the country's gaps, and the application will then be restricted within the country, and the capacity within the country is what is going to be used to implement that particular grant, with support from ourselves and WHO, of course. So all have sort of pros and cons, and we need to carefully look at which one will give us the best advantage to be able to get approved by the pandemic fund process. So these we can be able to handle on a case-by-case basis, but we always see with the capacity that we have on the continent, when you go several of you, it is always easier than when one country goes on its own and gets a much smaller portion of the funds that are available. Thank you.
Okay, Owen, please, Ogwell, please, you should be stand by. There is another question here from an anonymous attendee, but I think it is an excellent question to clarify here. So the question is, in case of the regional entity proposals, how can Africa CDC be part of the list of applicants and also be offering technical assistance to regional entities who are planning to submit a proposal? Over to you.
Excellent question. So let's take two scenarios. One scenario is the application by Africa CDC to be an implementing entity is approved before the second round is closed. In that case, our role as Africa CDC will be purely as an implementing entity, and that is usually to receive the resources, disburse them to the successful applicants, and then guide the implementation of that particular grant. So in that case, it is a very well-defined responsibility, including other implementing entities like WHO. If we are not, and if our application were not to be approved, then Africa CDC will be eligible to make an application, as well as be part of the implementation process as an implementing, as technical support to those who will have been successful in receiving the grant. So in that way, these two roles of providing technical assistance to any country or regional entities that may be successful will be more prominent if we were not to be an implementing entity. If we are an implementing entity, then our role becomes a much clearer, defined as an implementing entity. However, because we have the technical capacity and know-how, we will always be making that available to any country or any institution that may require it during the process of developing the grant application or during the time of implementation. That flexibility is still there. Thank you, Chair.
Okay, excellent response there. Okay, I see the hand from Malawi. I think Hichiponda Kondolo Kumbize. Please go ahead with your question.
Thank you so much for this opportunity to interact. I'm the Minister of Health for Malawi, and Malawi is one of the countries we applied last year. Unfortunately, our application was not successful. So we are happy that now we have another opportunity to submit our proposal as well. The first question, a country, can it make two submissions? One as a single country, the other one as part of a bloc. I'm asking this because Malawi, we have our own needs as a country, but then we have other needs in the neighborhood. Let's say with the cholera, it has affected Malawi, Zambia, Mozambique, the bloc, Tanzania as well. So we need some interventions as a bloc. So that is the first question. The second question is the duration of this grant. I did not capture it. Is it a 1-year grant, 12 months, or it's more than 12 months, the grant? And the third question is the conditions of the grant. I might have missed it, because sometimes, you get a grant, but you get conditions like, okay, if you have to procure something, you have to use this agency. And that agency, sometimes when you do the calculation, you spend more with the agency, the preferred agency of the donor, than if I had used my local agency in Malawi. So that creates a problem for us as well, because on paper would have gotten 5 million, but because I used that preferred agency, which costs more than our own local capacity. So
Hello?
we just wanted, yes, sir. Yeah, so we just wanted clarification on the conditions of the pandemic fund grant. Thank you.
Honorable Minister, we really appreciate your time to be in our call, and I think you have raised a number of issues here, in which I think I will ask Rick Brennan from a steering group to respond, and maybe in collaboration with Dr. Salam, because issues are related to eligibility of application itself. So Rick Brennan, Honorable Minister from Malawi, is asking if a country is able to apply for a country proposal as well as a multi-country proposal. Two, it wasn't clear on the duration of the grant, how long this grant is. And the last thing, is there any conditionalities in which are aligned or associated with the grants? Over to you, Rick. And
Great, thanks, Dick. So yes, a country can submit for both a single country proposal and a multi-country proposal, provided they're not one of the 5 successful recipients from round 1. And those countries were Cape Verde, Burkina Faso, Ethiopia, Zambia, and Togo. So those 5 countries cannot submit a single country proposal in the next round. They can submit multi-country or regional proposals. They can be part of those joint proposals. All other countries are eligible to submit all types of proposals. Then in terms of the duration, I understand it's 24 to 36 months. I might have to turn to my colleague, Dalia Samhuri, who can give clarity on that. And then in terms of restrictions, I'm not sure that there are restrictions apart from, in terms of eligibility. But again, maybe Dr. Salam or Dr. Samhiri can elaborate further on that.
Okay, excellent, Rick. Okay, Dalia is on standby there to answer the question or elaborate. Please, Dalia, over to you. Okay, so we don't have Dalia, but I see, I see another hand here from Kaseya. So I don't know if you want to ask the question or you want to respond to the question. Because you are presenting.
I don't want to ask. I want to support my sister from Malawi. Thank you, Minister. I think every time that we meet, you have clear point. I can remember what you told me during the World Health Summit. You even said, I think I will never be invited because my questions are so direct. No, what you are saying you are right. And I think the first question, it was responded successfully. There is nothing we can hide. It's clear that a country can submit the three types of proposals: country proposal, multi-country proposal, and a regional proposal.
Yeah,
Because a multi-country proposal can be just 2 or 3 countries coming together.
I'm not
A
sure.
regional can be, as Dr. Mwete and myself were thinking about it, around the regional economic community. Like for you, with, as you said, with cholera, we are talking with the executive secretary of SADC to see how, thanks to the support from your head of state, to have a strong regional proposal. It means we can think about how countries can come together while they are also sending a single proposal. But I wanted mostly to talk about what you raised. You know, Africa is changing, and I have to make it clear. This is why we have these meetings for alignment of partners. I think this opportunity for me to inform you that in 8 days, 8th of February, we have a meeting with principals of all partners, Global Fund, Gavi, USAID, all of them, to discuss about alignment on the community of workers, and then later on the alignment on the support they are giving to countries. We'll never accept to see our countries to be imposed. I repeat it, we'll never accept that. And what we are doing every day is to stop that. Like in Malawi, what WHO, Afro, and Africa CDC will do is to provide appropriate technical support to yourself, Excellency, and your team, plus your partners that you think must help you at country level to develop a strong proposal. And the modality of implementation, it will be yourself who will decide. We are not there to impose you. No one will come to impose you. If you say, for me to implement this grant, I need to work with local organizations, you give the name, you give why you want to work with them, will follow your leadership. Because at the end of the day, it's the government who is accountable. I think I wanted to clarify that because I saw many colleagues, they were also sending me messages about imposition that they are getting from some donors. That one is not the case. And if you have it, please email me. All of you have my email address. Email Dr. Mwete or email our new regional director. Copy all of us. We'll deal with that. I wanted also to apologize. As I told you, I have a meeting with Dr. Tedros, who is coming with his team to meet to discuss the pandemic fund. They told me they already left. I have to be ready to meet them. I know that Dr. Mwete and Dr. Anand and all other colleagues, they are well equipped to respond to all questions. But if there is another round, I will be there. I'm so sorry for that. I have to leave you. Bye.
Okay, appreciate His Excellency Director General, and apologies, I hope is accepted, and please help to push to have a consensus of the pandemic treaty there in Geneva, as you said. So we have other 2 hands here which are raised. I want to remind all of you, we have already passed the hour in which we are allocated. So I think from the Q&A box, there are a number of questions in which they could be easily responded if the country offices or our ministries will be able to be availed with the pandemic fund guidance document, because it has a number of issues in which will be able to be elaborated there. However, there are only 2 other questions in which I'll be interested to ask for our panel to actually to ask. And one question is coordination.
This is Dr. Mwete, sorry.
Yes.
Excuse me. Can I just add something to the response the minister asked about, if you like, the cost of being supported? First of all,
please go ahead.
Yeah, okay. Thanks very much for a good question, Honorable Minister from Malawi. Just to say, I hope that everybody's received this, and there's a pandemic fund document, guidance note for applicants. to the second call for proposal of the pandemic fund. I think we need to make sure that it's circulated and the member states, the ministers, and different colleagues who are going to work with them actually receive this document. It's a good guide. It does say it talks about cost recovery for implementing entities and sets out what are the percentages, if you like, that an implementing entity might, what are the ceilings, in fact, that are permissible for an implementing entity to request to charge in order to mobilize some of the capacities and deal with the admin and other costs. So it says there's a cap of 7% as a percentage of the amount requested for activities related to preparation, admin, supervision of the funds. And then in more challenging circumstances like small island states, it could go up to 10%. So I think that's what's in the guidelines. It could be that an implementing entity in conversation clearly with the government recognizes, I think, what are sometimes very valid needs. So this is going to be a process that's going to involve quite a few countries, different levels of proposals. So if there is a permission for some of that funding to be spent on mobilizing some of the capacity, especially for some of the management and admin, it's something that could be discussed, in my view. And hopefully it will be seen that some investment, a reasonable level, is acceptable. Clearly, the main idea is to have the resources available for implementation. But because it's a simultaneous process in multiple countries, I think we need to be realistic and acknowledge that some support might involve a small cost and probably would be worthwhile for the outcome. So just to be transparent and to let people know what is in the guidance, that's what is proposed. But clearly it's up to the decision of the country that's making the application. Sorry, I just want to be useful to complete the response to that.
It's okay. It's really an excellent addition there, Dr. Moeti, because a guidance document of pandemic fund application is also online and is able to be easily accessible. And I think a number of the questions in which we're asking here also are related to the either instructions or any guidance in which are articulated clearly in the guidance document. However, before I'm handing over to the MOH Ghana, there is a question in which is repeating over and over in the Q&A box, and is the issue of coordination of application process in country and in the multi-country proposal. The question is really about, in case of One Health application proposal or proposal application, who or actually what ministry is taking the lead? The Minister of Health or any other ministry? And also if it will be the multi-country proposal, in which also as a component of One Health, who is coordinating that? So I would prefer to hand it over to Dr. Salam to actually, I think, prepare an answer. And at that time, I'm also asking Jakalia Telma from MOH to be stand by for this question. Please, to you, Salam.
Thank you, Dr. Dick. Just to talk about something before to answer the question. The eligible country have to be IDA, International Development Association eligible, or International Bank for Reconstruction and Development eligible. Some countries, unfortunately, are not in that list, but it's a very small country in Africa, and you can consult it in the website. I don't want to say any country because it is a dynamic list. Now, for the question on, remind me, please.
On the question of coordination.
The coordination, the first is for the coordination at the country level. Actually, we are here to support, and it is not the partnership that will determine who is coordinating at the government level. I'm sure that there is some similar applications that happen in those countries, and it is advised that it is multi-sectorial. It should not be just limited to one ministry or even two ministries. It has to be multi-sectorial, the Ministry of Health, the Ministry of Agriculture, the Prime Minister's office, or all the entities in the government that may be interested. As a partnership, we will work with the country as they determine it. That coordination should not also be limited to the government only. It should involve some agency like UN agencies, or if there is any other entity that the government is working on global health preparedness and response. At the multi-country level, the GIP is well prepared to help on the coordination, but it's going to be a bottom-up approach. It is the countries that are going to write first their draft and send it to the GIP level that will try to put them together, come to negotiate when it is very overlap or very some issues. And at the last, it is to the countries to decide. And also, when the funding is approved, it's going to be distributed entirely to the country if it is a multi-country proposal, who are the beneficiary. And it is up also to those countries to decide who is going to be the implementing entities. WHO, who is eligible to be implementing entity, is not into this partnership to be implementing entity. We are into this partnership, and our goal is for the countries to get funding. Yeah, and after the country to decide which is the most appropriate to be the implementing entity. Over.
Okay, I appreciate Dr. Salam for elaborate answer. So, MOH Ghana, please, you can ask your question, Thelma.
Thank you very much. Yes, I was just wondering if it's possible to share maybe what the reasons are for a country like Ghana not qualifying in the previous one, so that it would guide us in this time round, because we are all poised to make it this time, but at least a guideline from the previous one could guide, could assist. Thank you very much.
Okay, I think our steering group members, you have had the question. If there is any explanation of why the previous proposals were not successful, it will help our member states to improve our next proposal. But I don't know if there is any person who is ready to respond on that. But the other thing I needed to bring it up here on the table, that if you remember the presentation of Salam on the structure of the GIP, there is a core group in which is also helping on the technical issues on the pandemic fund preparations. I think there was the plan to organize a technical briefing with technical members of the Ministry of Health, in which you'll be able actually to elaborate. In answering on your question, the last year, at the end of the last year, Pandemic Fund Secretariat actually organized a debrief meeting explaining on the outcomes of the proposal. And what I remember is that they promised they would have prepared an individual letter to each country in which is actually had a proposed, and the reason why a proposal it wasn't successful. So because of time, I think I will only allow two last questions. Yes.
This is Dr. Moeti. Sorry.
Yes.
Very briefly, just to re-emphasize the importance of downloading and looking at this guidance book. I think it's very important. Because it responds to all these questions and emphasizes certain, if you like, technical areas that apparently will support the success of proposals. And as you said, there's indication that all the countries that didn't succeed got a detailed feedback on what was it that was problematic. So hopefully that would help. I was also thinking it might be useful, as I said before, then so for the countries that did succeed, to find a way of sharing their process, the structure of their proposals, and if they are fine with that, since anyway they are not eligible for this time, then that can be shared with other member states that are interested in submitting individual proposals. That could be a help. I think this guidance is very detailed in some of aspects that are emphasized. I would say for the One Health, I think it's very much up to the country, what they are doing currently, how they structure One Health in terms of leadership, but it's just important that the different sectors, the relevant sectors be involved. And as I said in my presentation, there's some emphasis on also involving civil society, involving the civil society organizations as well as community level participation. I think these are all elements that hopefully in the technical briefings will be emphasized. So it's very clear to member states, since it's a very quick process, what are critical elements to think about as they are initiating the process. Sorry to talk for so long, but I thought that might be so emphasized.
Okay, no, I mean, I think it was an excellent proposal that for those countries in which had a successful proposal in the first round to actually try to share on their lessons and their proposal to other countries. So I would like now to welcome a Director General of Nigeria, CDC, Efidayo, to ask you his question. Over to you, sir.
All right. Thank you very much, the organizers of this meeting. I'm here representing the Honorable Minister of Health and Social Welfare. I would like to ask a question about the regional or multi-country application. And I hope that perhaps the regional office and maybe representatives of ECOWAS, if present, can assist with the answer. As you know, Nigeria is surrounded by, on its northern border by Niger. And we are keen, given the experience with ongoing meningitis and diphtheria outbreaks, to perhaps use this opportunity to strengthen measures around cross-border surveillance. But we are also aware of the various political challenges that we have now in terms of engaging with many of the countries that we perhaps should engage with. And I'm just wondering if between the regional office and the African CDC and WAHO, if there are any interventions to sort of help coordinate the engagement at this level. So that's my question. Thank you very much again for the very informative session.
Okay, okay, excellent question. So I think I will hand over this to Dr. Ahmed Omar, if you be able to respond to our Director General of Nigeria CDC. Over to you, Ahmed.
Thanks, Dick, and thanks, DG of Nigeria CDC. I think one of the very strong push in this pandemic fund has always been surveillance, and cross-border surveillance is really essential for us to be able to control, some of the outbreaks that are multi-country in nature. And the design of the proposal is the one that is going to guide what level of importance really that cross-border surveillance is going to be given in a particular grant. And the technical support that will come from ourselves, Africa CDC, from WHO, that's a given. And all you need to do is request for that and we will be able to provide it. But when we are looking at the fund application, then the regional approach vis-a-vis the multi-country approach is going to be very important when it comes to cross-border surveillance, because there are borders that bordering one region to another, and all that need to be made clear within the grant application, so that if one region were to make an application, then the bordering countries of that region will then form part of the cross-border work that needs to be done under the grant. So within, if you look at the guidance document that has been given, some of these become a little bit clearer, but we'll work with yourselves and the neighbors to ensure, including Niger, to ensure that these applications cover the sensitive areas when it comes to a disease spread across borders and across regions. Thank you.
Okay, I really appreciate Dr. Ahmed. I think mindful of time, we already passed around 20 minutes from the allocated time. I think it would be okay to close this meeting in the next 10 minutes if we all agree to allow our leaders also to actually have other engagements. So I see one hand from Dahlia. I don't know if it's an old hand because you're part of this secretariat. Okay,
Thank you
Dahlia?
so much. Yes,
Yeah.
can you hear me?
Yes, please go ahead.
I just wanted to quickly follow up on the question from Dr. Brennan. So the duration for the project actually is to allow the implementation within 3 years. So this, in other words, it depends on the country and it depends on the plan that they are putting within the proposal. The most important thing is that this should be implemented within 3 years. One more question was related to the different challenges or gaps that were scored in the or reported in the previous set of proposals. We have actually been receiving some of the information and we managed to put them together. So in summary, and maybe for the benefit of everyone, I still know that there are specific challenges or gaps in the specific proposals, but the words that I'm going to say is basically general remarks that were put together. One is the lack of risk profiling or understanding of the actual risk inside the country and how this kind of risk is associated with the proposal or writing the proposal in a way to improve the current situation. The second one was the lack of clearance on the multi-sectoral coordination inside the country for the benefit of the proposal. The third one was related to the actual identification of the co-financing and co-investment procedures. And for that, there has been a lot of requests to the Secretariat to come out with specific guidance that would help countries in moving forward in the right direction when it comes to this area of co-investment and co-financing. One more gap was related to the inability to identify the vulnerable groups and to ensure there is gender equity in throughout the proposals. And also one area was related to the lack of engagement of the civil society organizations, which might be needed in some parts of the countries in order to be able to achieve or to reach to the vulnerable groups. The last part was related to the actual implementation plan. How detailed is this implementation plan? And more importantly, the costing for the different activities, really to be realistic in putting these costs with the understanding of the risk and how this can be implemented. Let me conclude by making sure that in writing the proposal, really to make sure that it's aligned with the overall objectives, but also it's aligned with the different parts of the IHR monitoring and evaluation framework in order to enhance the overall capacity inside the country for prevention, preparedness, and response to public health emergencies, including pandemics. Thank you, Dick. Over to you.
So they appreciate for this excellent addition, Dahlia. I think it has answered a number of the questions, particularly for those people who are interested to understand the reasons why some of their proposals were not really successful. So there had been a number of questions still unanswered in the Q&A chat room here, but our technical team here from the core group has promised that we will be emailing all the written responses to all the questions in which will remain unanswered. And I think a timeline we have for receiving these responses, it will be tomorrow. And we understand also there is a plan to develop FAQ, the frequently asked questions. I think we will also use it to answer a number of your issues in which it has been actually raised. So I will take the last question from Dr. Tumba Windokuni. And after it, I think we will be adding to our conclusion. Okay, Doctor. Is Dr. Dugma? Okay, he's still on mute. So, IT, is he unmuted?
His microphone is activated, but he's muted.
He's muted.
Needs to unmute his microphone.
Okay, Dr. Tugma, please unmute yourself and ask your question. Please go ahead. Okay, we don't hear from Dr. Tugma. I think I'll be concluding. We are now approaching the end of our webinar. Honorable Ministers of Health, we really appreciate you taking your time from the busy schedule in which you have, and we really value your contribution and the issues in which were raised. We would be interested to know actually your thoughts on the proposed pandemic fund approach, the common African approach, and look forward to your guidance on how to facilitate discussions with other relevant ministries in your countries. We will also continue working with your relevance, the department at the technical level to support this process. So before I conclude and close the webinar, I will return to our leaders to ask if there is any last comment either from Dr. Moeti or Dr. Balki or Dr. Ouma now in the absence of the DG. Please, Moeti.
Okay, thank you very much. First, I'd like to sincerely thank all the honorable ministers, all the senior technical officials, and those who joined us for this meeting. Merci beaucoup d'avoir été avec nous. And just to say, it was a very brief initial briefing. We have conducted a brief with the WHO representatives and also the regional coordinating centers of the Africa CDC. Our expectation is that these colleagues then will follow up with you if there are any additional questions, those that were not adequately answered through them as well. I think we can have an interaction. It may be that there is need, once the process starts, for further interaction to see how people are doing initially, and if there is any more support we can provide in terms of explanation or guidance. And I'd like to say, together with our colleagues at the Africa CDC, just referring to the DG Nigeria's question, we will rely on you and the neighboring countries to try to find the best way in which it can be possible to support, if necessary, cross-border joint work, because that continues to be necessary. So just to say thank you all so much. This is the start. We are here with our partner, the Africa CDC, and our colleagues in WHO, EMRO, to continue this support, that we are mobilizing the additional support that will be needed to do this simultaneously. Thank you. And it's just a start, we'll continue.
Thank you so much, Dr. Moeti. Okay, Dr. Balki, any last word? If he's still around. Rick is already around there, because I don't see her now.
I think she may have left. No, I think that, look, I think it's been a very useful discussion, great questions raised for those that we haven't answered. As you've indicated, Dick, we're committed to following up. Again, this is a great opportunity for the continent and for public health more broadly. So, while we're a relatively smaller partner in this cheap partnership, we're no less committed, and we are fully behind this initiative, and we'll commit the necessary resources to help the member states have as successful submissions in the second round as possible. So you can count on us as being a reliable partner. Thanks very much.
Yes, appreciate that remarks, Rick. So to Omar Ahmed, any last words?
No, thanks a lot, Dick. Only to say that time is short, and May is really just some 3 or so months away. So we have a lot to do, and let's do it together so that Africa can be able to benefit this time, proportionate to the challenges of health security, health emergencies that we have. Count on us, Africa CDC, EMRO, AFRO, to support you, but do come forward so that we can be able to work together in the short time that there is. Thank you.
Okay, with all of the remarks we've heard from our leader and our steering committee member, at one time we reached a total number of the participants of 228. I think it is an indication of how critical this webinar has been. So without any further ado, I will officially close this webinar and have a good day and a good time, all of you. Yeah, merci beaucoup. Bye bye.
Merci, au revoir. À bientôt.